Hello and welcome to this second webinar of VOPD series on the VOPD series. I forgot the name of it, the technology used for COVID-19 response. So we're here today going to listen to two prominent speakers from Norway and Sweden, Kristin Standal and Katarzyna Wikström. But before that, we're going to give you a short introduction where who we are and who we are representing. So if you pull up the presentation. Please.
Yes, I will share the screen here. There we go. I'll take the next slide. We just could repeat. My name is Bengt Andersson and I work at Nordic Virus Center. Just repeat that during the seminar you can submit questions and you do it through the chat function, just to repeat that for you. So please come with questions to us and we will continue and having them and asking them to our presenters. Yes. Let's see if we can go on here. Yeah.
Yes. Healthcare and care through distance planning solution is a project part of the Swedish presidency program of the Nordic Council of Ministers from 2018. We have been extended to continue with this collaboration until mid-2021, until June 2021, and our this collaboration and our final conference for this project will be on 25th of March next year. But more information on that will come. So you have heard our names. I'm representing an organization in northern part of Sweden, and I will get back to that later. The webinar series, Technology Used for COVID-19 Response, is an initiative by the Interreg Northern Peripheral and Arctic program, who was part of this collaboration. This technology used for COVID-19 response is organized through a project called Tech Zones. And that project is run by Professor John Condell at Ulster University. If you take the next slide.
Yes.
So this is the agenda for today. Short introduction by you and me, Bengt, and maybe you run through the other steps of the agenda.
Yeah. After that, we will listen to Kristin Standal. It comes from Norway, working in the program for welfare technology. And she will present the roadmap for service innovation that they have been using for a couple of years in Norway. Then we hope you will write down questions on the chat, and we will discuss these questions with Kristin. And after that, we will listen to Katarzyna Wikström, who's working in the region Västerbotten in Sweden, where they've started to use this roadmap for service innovation on a local level. And we hope again that you will write down questions to us through the chat. We will discuss this with Katarzyna. And after that, we will have a discussion together and a short sum up, and also information about the upcoming webinars that we have late in November and in mid-December.
So Center for Rural Medicine is the organization where I'm connected to. This is an R&D unit forming part of the local healthcare district of South Lapland within the region of Västerbotten. Our organization is about having about 15 employees. Main office is in Storuman in Sweden, which is the very inland of Västerbotten County. We are an R&D unit and funded mainly through projects. And the absolute main part of our employees is based on the inland of northern part of Sweden. So if you take the next slide, please. So this is the main focus that we work with, which is a primary care reform that is currently being implemented called good quality local healthcare in rural and remote areas. The latter part there is our amendment. But we also have specific responsibilities coming to Sami health, but also to education and recruitment. Bengt.
Yes, as I said, I'm from the Nordic Welfare Center. That's where we are right now here at our offices. We have a small studio here where we're sending from. And Nordic Welfare Center is a part of the Nordic Council of Ministers responsibility, and I'm working as a senior advisor in that area. We are, as I said, an institution on the Nordic Council of Ministers, and we have offices also in Helsinki, and we are around 30 employees. And my area is welfare technology. Or as I often more say, digital transformation in the public sector and foremost with the municipal responsibility. Okay.
Yeah, maybe if you take the next slide, please.
Yep.
Yeah, I thought that we could give a background why we are at all collaborating on this topic. First of all, Nordic Welfare Center is mainly having the responsibility for distance planning solutions connected to municipalities, local authorities in the Nordics, and our responsibility as a healthcare region is more to work towards the healthcare sector and distance planning solutions connected to healthcare. So that's the distribution of responsibility between us. Our organization, Center for Rural Medicine, is the coordinator of the entire project. We should say this project is also connected to a specific side project called e-prescription across country borders, which is run under the responsibility of Swedish e-health agency. But this is a starting point where this collaboration took its form. An aging population affects the welfare model. We can see that the Nordic municipalities, 70% of the Nordic municipalities are vulnerable because we have a very high level of plus 65 years citizens in our regions. If you go to my healthcare region, and especially the inland part of this healthcare region, South Lapland, the 7 most inland municipalities, there we are plus 30%. So we're very, very vulnerable. But on the other hand, and in addition to this, by looking at this and seeing the use of distance planning solutions as a opportunity and a strategy to overcome this challenge, we can also see that we can protect our most vulnerable citizens that are being heavily affected by this pandemic situation that we are currently in. If we take the next slide.
Yep.
So today we're going to listen to 2 speakers, as I said before. One will be Katarzyna Wikström, and the second one will be Kristin Standal, or the first one in line will be Kristin Standal. You will introduce Kristin in a minute, but I will just underline the questions that we are going to put focus on. And these questions are outlined by the COVID-19 response group as important discussion, important questions for discussion. It's about how can technology be brought to those people who need it and not necessarily know how to use it. So we hope to be able to give some inspiration and some guidance on how this could actually be achieved by having these 2 speakers today. So, Bengt, who are Kristin and why are we going to listen to Kristin today?
Yeah, what we did in this healthcare and care through distance planning solution was that we mapped all visions, and then all 5 countries' visions and strategies, and also tools for implementing distance planning solutions on regional and also municipal level. And what we came with, what the results is, the main result, the most important result was what's called Vägkart för tjänsteinnovation in Norwegian. Roadmap for service innovation is the best tool that we found, and it has been used for several years in Norway. And that's why we want to hear more about this, to get this presented by Kristin Standal, that is project manager at the KS, Association of Local and Regional Authorities in Norway. So I give the word to you, Kristin. You're going to share your presentation from your computer.
Yes, thank you very much. And thank you for inviting me to this webinar to present both the program in Norway and the roadmap for service innovation. I'll say a little bit about myself. I'm an educated registered nurse and also have a master in health informatics. So I have a combination of technology and health profession or education. And as Bengt said, I'm a project manager in KS, the authority or the Organization for Local and Regional Authorities. First, a little bit about the national program on welfare technology or technology-enabled health and care. What we always say is that just find the right screen to shift slides. We always say a lot to all people and municipalities that this program or welfare technology does not really is the main focus is not the technology, but it's about the people that we are going to serve and also on how we can innovate in the way we deliver care. That's the most important thing we do. So we are not developing new technologies, we are developing new service together with the municipalities. This program was set up by the government in 2014, and the main goal is that welfare technology will be an integrated part of how the municipalities deliver health and care services within the end of this year. The COVID-19 has made some delays in our project, so we just got the notice that we will keep on another year, so we are happy for that. But what we do is we are striving towards the goal that technology-enabled care will be the new normal. I'll say a bit more about how we are achieving on this goal later on. The program is a collaboration between the Directorate of Health, the Directorate of e-Health, and KS, the Organization for Local and Regional Authorities. As I mentioned, we started in 2014 and we recruited approximately 30 municipalities in the first phase. So, and what we did, we could offer grants to these municipalities to pilot technology and pilot services so that they could learn and develop services and tools so that implementation could be easier later on. These first municipalities were followed by researchers so that we made sure that we got access from the results and experience. And this enabled us to make knowledge-based decisions and recommendations or guidelines to other municipalities. So these guidelines were recommended to other municipalities, and we are now in a dissemination phase where our goal, as I said, is to upscale this and make welfare technology the new way of giving services, one of the new ways of giving services. We are supporting the municipalities to reach this goal by giving them grants for project management in collaboration projects between 2 and 23 municipalities are collaborating in projects. They get the process support in service innovation and implementation. And we also made some knowledge-based or some teaching materials so that we can teach the employees in how to work with welfare technology. And an important role that we have is to share or make national spaces for networking and sharing experience. Because, well, we have always been looking to others and seeking for information, but the knowledge is developed in these networks, and we have to learn together and develop knowledge together. So these networks, national networks, are really important. We also follow the projects closely. Yeah. So we have made education material, and our main tool is also the subject for this seminar, roadmap for service innovation. And the key elements in service innovation is uses service design as a method, and we focus on benefit realization and anchoring. So these are the key elements. And the use of service design in services in Norway was not very much used in the public sector in 2014. And these 30 municipalities that started in the program were together. We have together developed this roadmap. I'll say a little bit of each phase and focusing on the first 2-3 phases mostly. So as I said, anchoring is the most one of the key elements, and it's put up in a phase here, but we also stress that anchoring is something you have to do throughout the whole project, the whole phase. It's a continuous effort you have to do. So you have to define goals, explore what benefits or gains you want to achieve. So here you see that benefit realization is focused from the start, and that's why we're doing this, because we want to gain either better quality for the user or economic gains. Of course, we focus on the project manager's role, because what we experience is that a lot of, a few of the municipalities had very much experience in project management in this sector, health and care sector, which are where most of the project managers are recruited from. And the insight phase is another really important phase. And here we met I talked about the recommendations earlier. Our recommendations were focusing on different kinds of technology that these first municipalities had experienced good gains from. And that made the new municipalities that came into the dissemination phase to also focus on the technology and not putting too much attention to what are the needs in my municipality and what will give the most benefits for our citizens or users. So we are making the municipalities do the insight work really thoroughly, because that is the way that you can ensure that you don't focus on the wrong subjects and do wrong decisions from the start. So all the municipalities have been told that you have to do your insight work once more and focus on what is most important here. And we focus on different methods on how to get this insight. And the circle with the cakes on the upper right shows different ways of getting that insight and how much time you should spend on those different activities. So as you see, talking to people, the users, the relatives, the staff, everybody should take the most time. You should look at statistics, and you should also look at how the service is delivered today, and look for where these are problems. So here it's really important that it's not only the employees in the municipality that are doing this insight work. You have to look at your problem, or your you have to look at this from different angles. And as I say, when I show this next slide, please remember this next slide, because you have to remember that these two people are looking at the same thing, but they are seeing really two different things. And that's why insight work is so important, to really understand what is my users need here. And in the roadmap, there are different tools that can be used for this insight work, or in every phase, there are tools that can be used for the different activities that you go through the process. And one of these are looking into the stakeholder map, and this is done in the nursing home, this example. And what you see when you look into this is that when you're putting welfare technology into a nursing home, there are a lot of stakeholders that you should think of. It's, for instance, the maintenance and service people who really have to understand what technology makes, or what the changes are when technology, smarter technology, is put into the nursing home. And some of these needs information and education on how to use these technologies and so forth. So in a nursing home, you probably will have at least 100 stakeholders when you look to all these different people that are affected by this. Another way of looking to get insights is to look on what happens during a night. Here, this slide shows a patient's night, and where that the user feels insecure during night. And if you look at these two together, you can see that the user is most insecure when the nurse is most busy. And that's, of course, makes sense. But if you don't really map this out, it's not always easy to see that this is a common problem and is getting together. Yeah. So using these service design methods, you really get a deeper insight, and it's also fun to work with these methods. Service development, you have now looked into the insight, you found the problem, and you should start working with ideas on how to change the service. And another tool that we use then is the user journey. And I think this picture is quite good because it compares the user journey, well, the steps for the user with a theater. And the public, the user sees what's happening on the scene, but all that happens behind the scene to make this performance look good is not visual for the user. And here is where workflows and technology supports what happens on the scene or the points of contact for the user. And you can also here see, look for the bottlenecks. What makes this service or this dance be not as good as it could be? So when you're working with user journey, you should really focus on the user and what's happened on the scene and what are the bottlenecks, and work with the bottlenecks to make this journey better. So you use paper and Post-its and work together to see how this user journey is for the user. And here it's really important that the user also takes part in this process. So the piloting phase here is where you plan how to implement and pilot, and you should test both the service that you have designed and how should this be when you have changed it, and also the technology. And it's because you test the service, you also have a possibility to adjust the service if it doesn't, well, if it's not good for the user. So here you can make mock-ups or play the service and test how it works out. So phase 5, here you're planning the operations, and it says carry out procurement. Of course, you cannot carry out the procurement so late in the process, but here is where you finalize the procurement process. So you have to plan that earlier on, but we had to put it somewhere. So here it is, and a lot of effort has to be put in this phase. And here it's really important that the leaders, the managers of the service have and take a central role. And that is what we experienced this last year, that we really had to address their place in this. Yeah, and then it has to be continuous focus on the new practice to be sure that you follow the new way of giving the service. So this is also a very important step for the managers. We have made some additional guidance, some quick guides on topics that have been difficult, and we really see that an easy and simple explanation on different steps have been very useful. I see I'm almost, my time is almost out, but I would like to show you our latest invention, and that is a comprehensive service model. Was the best English word I can find for it, but I'll show you this slide, which is in Norwegian. I'm sorry for that, but these boxes represent different tasks that has to be focused, and you have to have a responsible person on every single one of these boxes to make sure that the service is safe, secure, and is going in daily. So and that's also to put focus on what or how the different actors influence the service model, and what you have to think of as a municipality on who to put different chores on. So this can be shared, and yeah, that was what I had been thinking of saying today. And I'll show you this last slide that shows that 72% of the municipalities now deliver health and care services as the new normal. So it's a bit way still to reach the goal, but from in a year, it's been a really good development in this. Yeah, so that was my presentation. I'll take the presentation away.
Very good, Kristin. Thank you very much for your presentation. It was interesting to hear. We have heard you before speaking a lot of times, and it's also raising a lot of attention and a lot of, what should I say, excitement among people that are in a phase where they need to start making this transformation. So I have a few questions online for you, but I have a first question. You gave us a kind of status on at the end here. We have been working with one of your connected partners to this, which is a company called PA Consulting, who provides process support for municipalities. And when we have worked in our group, other experts have asked PA Consultant how many municipalities have actually gone through this, and how many municipalities have they advised. Could you try to give us a kind of scope? How many municipalities are we speaking about here? But also how many different services have been implemented within the municipalities as such, so we know the scale here.
Yeah, in Norway we have 356 municipalities in total, and 290 of them has been a part of the national program, so approximately 80% of them. So this 72% is out of these 80% of the municipalities. We only have numbers for the ones that are participating in the program. We have been focusing on 5 or 6 different technologies, and that's what we are counting now.
So the results are basically amazing. You could say around 200 municipalities have implemented a variation of up to 5 to 6 services. From nothing to full speed, we could say here. This is not something that has actually happened overnight. Of course, it's something that you have worked with for many years, this transformation. But what we have learned from you is that you can't cheat. You have to follow the book, and you have to follow your strategy and your plan that you have presented to us here. But we have a question here from a collaboration partner of ours, Lisbeth Kjellberg. What has been the 3 biggest barriers in the implementation of the guidelines? If you think of municipalities that are applying, that are starting to make use of your guideline, what are the most challenging obstacles that they experience?
I think it's the time. They want to rush into implementing technology, and as I said, we had to pull them back to do the insight work properly. So that has been a problem. And of course, we are introducing a lot of new subjects as benefit realization, change management, and so forth. And that is what we have really been pushing this last year, is the benefit realization, and to get the leaders on board to lead the change processes. And that has helped a lot. When we said, we actually demanded that the managers to join the guidance that we gave to get them on board. And they first they thought, well, should we really attend? And when they attend, they say that, oh, this is so useful, and this can be used in other sectors as well. And that's really important to say, that this roadmap is now used across municipal sectors, and also a lot of companies use them as well. So.
We got a question here. You mentioned 5 or 6 technologies that you're working with, implementing in the municipalities, and we got a question: what are these 5, 6 technologies? More in detail.
It's medicine dispensers, GPS, safety alarm, electronic locks, and well, a wider safety alarm, digital. I don't remember what I translated. Digital tillsyn.
Yeah.
Digital night surveillance.
Yeah. For example.
So we also have very similar question to the first one, but maybe a little bit more targeted to leadership. But we have one of our collaboration partners, Eva Kira, who is asking us about when it comes to implementation, one of the most biggest challenges that she experiences to get healthcare professionals to find time for this process. How do you actually secure that time is available for the staff that needs to be driving this? Give us now the key so we can actually solve this, Kristin.
Well, in Norway we have had some money to give to the project so that we pay for one project manager in each project approximately, and we also have some other grants that the municipalities can get, so that they get a little bit of amount of money to pay for that work. But it's a little bit of money. But what the project managers say is enough to get the attention, so that they feel they have to deliver something. And but then it has to. I think it's been attractive to join the Norwegian program, because they see that with the methods and with the guidance that we give, they really get a lot of help in the process. So we are very close to the processes in the municipalities. So and we push and support.
But we're happy that you're saying a little bit of money, because we know it's a little bit of money, me and Bengt, and you're coming from Norway, so sometimes people think that Norway is flooding in money, but it's about actually getting the commitment, as you said. A little money, if a municipality accept a little bit of funding, they also take on the commitment to it, and that's the key. So we have a question here. Is there an example of communication plan with the roadmap? What is the best way to communicate and get employees on board, especially during COVID-19?
I think what the one quick guide I showed is actually a combination of the roadmap and project management. So you can look up quick guide for velferdsteknologi in our website and see has this one made the municipalities and leaders see how much work should be put in and what the process in the project is better than the roadmap, because the roadmap is a big tool with a lot of different things you could use, but this quick guide is more to the point in this implementation project.
We also have a question here. How do the municipalities join the program? How does it work?
Every year we put out, well, they can apply to join, and there are some criteria. They have to cooperate more than, or they have to be more than one municipality, so they have to work together. And then they have to deliver on some goals, and then we do the assessment on which ones to take in, and when we reached 290 municipalities, we said, well, now we cannot take in any more, so we focused on them the last 2 years, but actually the rest that applied last year, they applied single municipalities, and then they didn't. They could not be taken in because they were alone.
All right.
Okay. We have a question here from Scotland. Outer hybrids in Scotland, who sometimes consider themselves as being Norwegian. So the question goes like this, Kristin. Fiona Morrison she says she really likes the pie chart showing the largest slice is listening and engaging with the relatives and those connected to the person. So how do you ensure that time is given for this not that easy measure? How do we ensure that we can communicate enough with the relatives and create engagement around the family around this?
No, that's one of the reasons why you should to use a lot of time in this insight phase, so that you can invite them or have open arenas where you invite next of kin, other people that are close to the users, so that you can get their objectives and views on the service that the municipality is giving.
What is your experience? How does this, what are the relatives and closest family members feel of this? Because this is the way, sometimes this is a service that is not physical, it's rather distance spanning. What is their immediate reaction when you speak about this to them?
They are more skeptical than the user.
Yeah.
The user wants to have these services because the wish of staying in their own home is so big that they accept using technology much easier than the relatives.
Mm-hmm. But as we have said, I think we have to move on. We have another speaker coming on. But Kristin, first of all, thank you very much for your contribution. I mean, we have collaborated with you for a while now, and we think that this is something that is very, very important, and we're very, impressed by the work that you're doing with the Norwegian Welfare Technology Program, and especially this guide, which is a simple guide. At the same time, it's so difficult to follow, and this is some of the contradictions that we can't really understand. At the same time, we also see ourselves making the same mistake. We're jumping into conclusions too quick. So anchoring and insight is your message here. Thank you very much, Kristin.
And you will come back by the end of this webinar, and we have some more questions, but we take them later on because we have to go on now.
Yeah, if you make us in focus now.
Yes.
We don't know why this is not being focused. Anyway, I'll continue. We're going to have a speaker coming up. She's a colleague of mine. She's no, it doesn't work. Now we're in focus. She's a colleague of mine, Katarzyna Wikström. She's leading a transformation in northern part of Sweden, in the county of Västerbotten, for the healthcare region of Västerbotten and the healthcare the part of the local healthcare district of South Lapland, which is the 7 inland municipalities of region of Västerbotten. The transformation is connected to something called good quality local healthcare, which is a primary care reform. So Katarzyna Wikström, can you put yourself into picture here and put your sound on?
Yes, hello. Can you hear me all right?
Yes, we hear you right. Perfect.
Yes, good. Well, thank you. Hello, everyone. My name is Katarzyna Wikström, and first of all, thank you very much for the opportunity to present our process in South Lapland. Very exciting to be here, and very exciting to actually talk about this topic. First of all, my background is very shortly. I have a background in both healthcare. I'm a registered nurse, and I worked in healthcare for a long time, also as a manager, but also have a master's degree in mathematical statistics. For the last 7 years, I worked as a municipality director, so I have the good knowledge of what issues are addressed there. But right now, I'm process manager for the process that is called Good Quality Local Healthcare and Care in South Lapland. And this project is financed by the government as a part of a model area, where South Lapland is one of the rural areas included, one of 4. And the aim of this work is to create organization models and methods of work in order to change or reorganize the healthcare and care in order to facilitate collaboration, both between organizations, but also with the civil society. Another aim is to investigate the possibilities of joint systematic data collection, and also to look at the structure and the evaluation of data and research. But in short, what the aim of my work is to facilitate and improve healthcare and care for inhabitants of South Lapland area. So this is a little bit about me and the project I worked on. But shortly about the outline of this presentation, a little bit about South Lapland, so you know the context. A little bit about the reform, good quality local healthcare, which Niklas mentioned, and also how is the Norwegian roadmap for service innovation implemented, and what is the next step for us. Right, so this is region of Västerbotten, a little bit about the area of South Lapland also. In Västerbotten in total, we are 270,000 inhabitants. They are urban areas around the cities of Umeå and Skellefteå near the coast, and most of all they are rural areas, which is the South Lapland. The population density is in total in region of Västerbotten around 5 inhabitants per square kilometer, and in South Lapland is 1 or maybe 2 in some places per square kilometer. So it's very rural. A little bit more about the municipalities and the healthcare system in Sweden. In Sweden, there are 290 municipalities and 29 regional councils or regions, and Region Västerbotten or Region of Västerbotten is one of them. Swedish healthcare is decentralized, so the responsibility is in every one of the regional councils. And the municipality's responsibility there is for the care of the elderly, in their home and in special accommodations, but also they are responsible for people with people who are discharged from the hospitals, and also a little bit about school healthcare. But for moving on about the characteristics of South Lapland, there are a lot of challenges. Niklas mentioned some of them. Very rural areas. For the last 40 years, there's been a population decline. Most of the municipalities in South Lapland lost maybe 1/4 of the population for the last 40 years. A lot of municipalities have around 3,000 inhabitants. We have difficulties recruiting staff, lacking physicians, nurses, and other professionals. We have also, as Niklas mentioned, demographic challenge. The percentage of elderly people is increasing. And if you take a look at the last 4 decades, the ratio of population above 85, as you can see in each municipality is rising. And you can compare it to the Sweden in total, which is quite stable for the last 30 years. So this is our challenges and a little bit about South Lapland, where we are. So now moving on to the reform, the good quality local healthcare reform. A little bit about that. During the last couple of years, there have been several inquiries from the government regarding national strategies for development of a joint roadmap for future healthcare and care in Sweden. And one of the conclusions in the report is that primary care has to play a central role in the healthcare system, but also that we need to in order to be able to have the funds and resources for the future healthcare and care, we need to work in a different way. We need to collaborate more, and we need to see it from this perspective. This is what is stated, that we need to focus on or person and relationship rather than the organization, that we need to work proactive and health promoting instead of being reactive, that we need to see the patients and the inhabitants as co-creators and active co-creators instead of see it as isolated healthcare and isolated interventions, and focus on the care receivers. So this is in general, this is what the report says, but it's not stated there how to do this. Only that this is where we want to go next. So the question is, how do you do this, and especially how do you do this in South Lapland where you have 7 different municipalities? Every municipality is different in terms of organization, different or semi-different goals and policies. And I wanted to give you a little bit of an example of one of the municipality. A little details about Malå, for example. They have a population of 3,042 inhabitants, and population of seniors above 85 years old is 113. The nurses that work in Malå municipality are maybe 7 individuals, and in Malå Cottage Hospital is around maybe 8. And I didn't mention, but Cottage Hospital is another characteristic of South Lapland. This is actually a health center with emergency beds. But as you can see, it's not optimal to have different organizations where you have staff working with the same patients, but a little bit in different where they are in life. Also, not only the organizations are divided, the services are divided, the ways of contact is divided, and it can be very confusing for the patient, and it's also quite ineffective. So in order to meet the expectations, both from the national report and from the inhabitants, we need to collaborate and co-create more between municipalities and also between the region and the municipalities. So we need a new system and a new way of collaborate, co-create. So where do we start with 7 different organizations if we want to collaborate and co-create? Well, the first step was to find out more about the long-term goals in every municipality, to do a review of objectives regarding healthcare and social care. The next thing was to meet actually the politicians and decision makers in every municipality. And we talked about where every municipality is right now regarding healthcare and care, what we need to do in the future, what the challenges are, and what we can do to tackle it together. We also had a workshop with managers and decision makers in municipalities and cottage hospitals. This was also quite important to confirm that we share well, the initial where we are right now and what we want to accomplish. We also, of course, have ongoing dialogue with co-workers. And most importantly, we also have a dialogue with inhabitants. Recently, last week, we had a survey in all municipalities asking the residents what they think of healthcare services, what they are lacking, and what needs to be done. So from this, after doing this, we actually established some main areas where we agreed that we want to collaborate and co-create. And the 4 areas was public health, collaboration and participation. This means we want to involve the patient in the care process. We want to simplify it and make it possible for the patient to collaborate and influence the process. We wanted to focus together on talent management, how to make our workplaces or organization more attractive, or can we collaborate in recruiting or education or training. Once again, we are a very small organization, so this should be possible. And also digital transformation, where we need to introduce digital services, but also combine them and be able to use the service in both organizations. And most of all, this is something that we defined together. We agreed on that this is the topics that we want to focus on, and we want to do it in all municipalities and in the region. So from there, we agreed to start with 2 projects. First of all, increased competence regarding digital transformation and digital leadership among decision makers and staff. And this is actually a collaboration between 40 municipalities. And the second one is increased number of digital services in municipalities and regional healthcare. And this is a project where we actually want to implement the Norwegian roadmap for innovation. So the Norwegian roadmap that you that we heard about here is tested in Norway, and it's a national strategy. And it has been working well in Norway, so we thought we can maybe use it, adjust it, and see if we can use it in South Lapland. And we decided to use in one of the projects that I mentioned, and this project started in June and is supported by the Swedish Agency for Economic and Regional Growth. And this is what we want to do in this project. We want to develop a strategy based on the Norwegian model. A lot can be recycled, we think, from it, and we want a strategy to work in our organizations and municipalities in Sweden. Introduced at least 2 digital services in each of the municipality. Also introduce home monitoring devices for at least 100 patients, since the number of inhabitants is so small in each municipality in South Lapland. We want to collaborate here and have a joint approach between municipalities. And also we want to analyze the synergies and develop a joint structure for the region and municipalities. And this is the last step, and this will be done in 2 years. Our goal is to have it done in March 2023. So the next step from there is, besides that we have other projects also starting next year, but to implement the started project and continue work, continue the dialogue with co-workers, inhabitants, politicians, and decision makers. And of course, challenging current policies and way of work in order to meet the intentions of the national strategy, good quality local healthcare. And to do it actually by collaborating, co-creating. So in summary, this was very shortly about South Lapland and the healthcare and the social care in general, and the reform good quality local healthcare. How we are tackling the in South Lapland, the change, and how we use the Norwegian roadmap for service innovation. that's it. So thank you very much for listening. And once again, thank you very much for the opportunity to describe our process in South Lapland.
Katarzyna, good to hear that some are picking up the good examples that exist in the Nordics. We think that this type of finding a way of applying a functional strategy in one country is a way of actually making it happen more frequent and more often across the Nordics. And since we have identified this strategy as functional, we have even decided and got our steering committee decision that this is nothing that we are going to further develop. But as you said, Katarzyna, you need to further adjust and further tailor this to the use of your organization and your municipalities. How important is it to have a joint strategy for you, because you're representing a healthcare region? You are going to collaborate and make this transformation possible for your healthcare region, for the citizens in your healthcare regions and 7 municipalities. How important is this type of strategy for you?
Well, very important, I would say, because we are, the municipalities are quite small and developing a strategy of their own and trying by themselves to develop this is quite difficult. The other thing is we have a chance here to actually do something together, both, help each other with this process. And actually, when we implement this digital service or a process, we can do it combined. So we can, help each other out, because number of patients or number of inhabitants is not that big. So if we do things together, I think we can have a more efficient process. So very important, I would say.
Yeah, we have a question here also, and it says like this. You mentioned co-creation. And the person that's asking the question is saying that co-creation is time-consuming and requires good leadership. Who is leading this collaborative partnership among the stakeholders and municipalities? As you said, the municipalities are very small. How is this being managed? How do you lead this?
Yes, and here is very important to have the policy, the leadership of politicians very clear, and they have to understand what this means, and they have to understand why this is important to work with. So leading this project, each municipality decides for themselves what they want to do and which type of collaboration and co-creation they want to join. But I think with having the big challenges among our municipalities, we see that together we can do it better. So the answer to the question who is leading this, every municipality has to decide for themselves if this is something that they want to do. And if they do, then we can collaborate and co-create, I think.
Yeah, we know that I know your work that you're doing. I follow it quite closely since we're working in the same organization, and I think what you are doing well here is that you're using the healthcare centers as one, physical station that you are having. You call it cottage hospital because you have this emergency beds in them, yes. And you work team-based there. So you work together with the municipalities and the healthcare centers to see what type of services would we like to provide to our population that are in our municipalities. And then you share knowledge between the different centers and the different initiatives that are starting to emerge now. So that's a very good, it's a very good strategy. I could just go back to the Norwegian presentation, the presentation by Kristin before. She underlined the need for the municipalities to collaborate in this type of implementation. So that could also be a strategy that you apply. Bengt, do you have another question here?
That was just exactly what I was supposed to say when going back to what Kristin said, where in Norway you have to collaborate with your neighboring municipalities. But we have another question here. Are there advantages of a rural area and small communities in service innovations process? Can you see that they have an advantage of being rural and small municipalities? Are there any advantages?
Well, yes, of course. As with everything, you've got these advantages and disadvantages. The advantage of being small, that you have, you know each other.
Yeah.
The people that work at the health center or the cottage hospital, they know who the manager of the municipality is, or who they would have to talk to get things done. And you can do it quite quickly. Also, you can your organizations are quite small, so you can collaborate better. However, we have the disadvantage of being two organizations, and this is something that is that has its obstacles, because each organization need to have their own digital systems or digital services, and this is where we need to find the common ground and collaborate more in order to co-create. And by co-create, I mean that we need to focus on the patient and actually not optimize for each organization, but optimize the services for the patients or for the inhabitants.
Mm-hmm. Because when it comes to in the inhabitants and or the patients, because they're the same thing, they from their perspective, it doesn't really matter if it is the municipality or if it's the regions that gives the services. So
exactly,
and I think that's one of the points that that Kristin underlined when it comes to insight and anchoring, that these phases are extremely important, and I guess that's where you will start as well, I think, working with insight and anchoring in the process.
Exactly, and in our process, the anchoring, it's not only for the digital services or digital innovation process, but it's also for the whole collaboration and the whole joint work together.
Mm-hmm. I could further underline the use of remote and rural regions. I mean, you have said it many times, Bengt, and I often speak about that opportunity when we're based in a very remote and rural region with very few inhabitants. First of all, people are very happy that we're trying to develop something for them. But secondly, what also is important to underline is that we work in a fairly in a system that is not that complex. If you would try to make this development happen in Stockholm, it would become too complex to actually see a transformation taking place. Mm-hmm. So, and with that said, I know that you have worked a lot with, or not a lot, but you're still in the starting phase of this, but you have worked with companies along this road that you have started to walk, Katarzyna. And the question is, how much are the companies taking part in this? How are they part of the co-creation process? How much are they involved?
Well, this is the first phase right now, and that means the anchoring process is the most important. And actually, to talk to the people that lives in this municipalities, to the co-workers, to actually make them understand that this is a new a reform. That's not only a project that will this is something that we need to do together, and this is something that we need to do. This has to last. So this is the first part of the process. Regarding companies and digital services, this will be the next step, when we need to first see what kind of needs do we have in the population, what kind of digital services are requested and needed, and then when we know that, this is the first step. When we know that, then we will involve companies, of course.
Very good. I think we need to round up here. It has been very good to have you on, Katarzyna. Very good to see you and hear you describing the work that you're doing.
Thank you very much.
I can just say that this with companies is a very important question. And I know that Katarzyna has been working with this anchoring phase very strategically and structured, together with all the municipal boards in all 7 municipalities and the political framework that is constituting the region Västerbotten. She has been very successful in raising funds as well. So you have funds now to develop a starting point for this transformation, which is also important. We heard from Kristin Standal that grants for investments is important. It's one of the building blocks of the ecosystem that surrounds us. So you can't just start from one day to another with this transformation. You need to do anchoring for a long period of time.
Katarzyna, could you stay with us maybe a couple of more minutes? And also, Kristin, could you come back with the camera and sound, and then we see if we have any more questions to one of you. So write in the chat or in the if you have any final questions to Kristin or Katarzyna. We have one question to Kristin that we didn't manage to ask to you earlier on. It's that you said that it is 290 municipalities involved. Could you say anything about the sizes and how they spread over the country of Norway?
Well, these 290 participate in 43 projects, and those are scattered all over Norway. So we have covered all over Norway. And it's very, very small municipalities, and Oslo, which is above 600,000. So it's the whole range. Yeah.
Do you know if the ones that are not have started this process, do they have anything in common, or is it just random that they're not in the program?
No, we haven't really analyzed that a lot, but we have cooperated with the regional state authority, Fylkesmannen, and they have helped recruiting municipalities in and actually motivated municipalities to go in. But of course, there are some municipalities that always want to work alone, and these are political decisions also. So it's not easy to get them all. No.
Okay. Then we have one question that is I think it's to you, Kristin, again. How do you approach the municipalities for the legislative data protection work? That is an integral part of the providing digital tech welfare services.
Yeah, that's in focus right now, because what I didn't tell you earlier is that this last year we have made some milestones that all projects has to deliver on. So the first one was gain realization. The second one was this service model, and the third one is about this subject. So the municipalities are working on this right now to get control over the information security and the data protection law and everything. So we have made some material that they are working with, and so that they have control over this themselves. So they are working on that now, and we're supposed to deliver that before Christmas, but now we have postponed that until March.
Okay. Is there a quick guide concerning this as well? Yeah.
Yes.
But that's in Norwegian, not
yes.
No other language. But if you know Norwegian, you can write that quick guide that gives you.
We will share the link after this one.
Yeah.
After this meet. But I think, when I listen to you, of course you have worked with this, Kristin, for many years. But I know that you have spoken about this roadmap. It's not only a roadmap for digital transformation of local, healthcare and or social care services. It's a general guide for digital transformation. So how much do you see this being picked up by other sectors?
Well, almost every week we are contacted by different companies or municipalities who want to use them in different sectors. So, but I have not counted, so I don't know. But what my most important role in the program has been to tell the directorates that when we are saying that the municipalities should use this method, we should also use this method. We should listen to what are the needs in the municipalities, and we have to change the way we work or support the municipalities on their needs. So we are quite agile and change the way we work and support when we see that they have some new needs. So we are changing this all the time.
But it's very good to hear. Katarzyna, you have in your mandate, you're responsible for this transformation of the new primary care reform, good quality local healthcare, initially for the 7 municipalities that are part of your local healthcare district of South Lapland. But how are you working more cross-border, if you think of geographical borders here, to include the entire region Västerbotten and other healthcare regions, municipalities across Sweden?
Well, this is very important, first of all, for the region, because there is a lot of things and process going on in the other parts of region Västerbotten, in Skellefteå area, for example, and Umeå as well. So we need to actually, keep an eye on each other and see what is going on. But in the bigger picture, we can't create a process that only is applicable for Southern Lapland. It has to be, we have to be able to integrate it in the region in total. And I would very much wish that we would have this digital strategy for the whole Sweden. So this is something that is not only for South Lapland or for the region of Västerbotten, but I would very much like to have this strategy in all municipalities in Sweden. But anyway, the things that we do, we need to have in mind and in the back of our heads all the time that this is something that has to be implemented also in the whole region as well, because this is not going to end in a couple of years. Because this is going to be a sustainable process and ongoing process, and we're not finished in a couple of years. We are only starting.
Yeah, it's a very good answer, because this is a starting point. You have now started, and Kristin, you have just started as well, I assume. But at the same time, this National Welfare Technology Program is about to come to an end. What is happening in Norway next now?
Well, as I said, we have got 1 more year for my project, and we are planning on how this should this competence organization, someone to take care of the networks and everything. We are discussing that now. So we are working on the strategy for when we are not there anymore. But as you say, this is started because the reason why we started working with this service model was that we see that if we don't have this national push on this, many of the municipalities will go back to old ways of working, and we are now working to help them implement this service model so that it keeps on working like that. So that's and the project managers in these 43 projects have said that this is so important that we still focus on this and help the municipalities anchor this across sectors in the municipality.
Very good answer. Bengt,
Yes.
I think we need to take our final slides.
Yes.
We thank you, Kristin, and you, Katarzyna, very much for taking part. You can stay for the entire session. And we will give you some final information from our side here. Yes, there we are. Yes, we have been spoken today about this vägkart för tjänsteinnovation. Färdplan för tjänsteinnovation på svenska, roadmap for service innovation. This is downloadable in English, in Danish, in Swedish, and of course on the website for Norwegian Association of Local and Regional Authorities. It's available there as a online tool. You should know that this roadmap for service innovation is a kind of a guide for how to do this. But inside this roadmap for service innovation, it's a number of tools. These tools are, in our case here, if you download the English version, you can be transferred through links to the tools, but they are in Norwegian. So that's the best that we can do. It's so many different tools that are built on experience that have been fine-tuned and further developed constantly by the Norwegian Welfare Technology Program. So we haven't the resources to translate them. But these are the tools that you need to tailor to make them functional in your local and geographical regional context where you are going to do your implementation. Icelandic and Finnish versions are coming soon.
Yep.
So by that, I think we have almost all Nordic languages except for Faroese and Greenlandic on.
Yeah.
So I hope that this is something that you will all pick up and start using. If we take the next slide, Bengt.
Yep.
We have also a previous webinar that we have recorded. The first webinar is uploaded on our website for you to review if you want to see it again. And this is where we're going to, save up all the webinars that we have. So
yeah, we're recording this one, so we put on this one on our website as well.
And if we take the next slide, I know that some of you took part at the work that our healthcare and care through distance planning solutions work are doing in our collaboration partner Nordregio, who is a spatial planning research institute that are based here in Stockholm, but they do different type of research, and they have done a very extensive work, case studies of 7 regions in the Nordics to see what is the effect on well-being and regional development when it comes to using distance planning solutions in healthcare and social care.
Yeah.
So this has been a report that has been published a couple of weeks ago, and we have also given you a link to that site where you can download the reports, as well as viewing their webinar that was conducted on the 21st of October.
But we're not finished with that. We're coming back again with a third webinar on the November 18th, and then we will go on to give practical example from implementation work. How can we fast track innovation? And on the 4th and last webinar on the 14th of December, we will be talking about wearables and response services. We come back to how to handle all these data, where to put it, and we see this as an innovation track. Yeah, and more deep into.
Yeah, I could give you some examples here. What we have done in our project Healthcare and Care through Distance Planning Solutions is that we have given grants out through 2 different calls.
Yeah.
So 53 municipalities have implemented distance planning solutions and 8 healthcare regions. So this is very small money that we have provided to them to initiate this process. But as Kristin Standal was saying before, it's not about the size of the money, it's about the commitment that they make when they accept the funds. So you will hear the practical experience from implementation work that we can share with you, and you will hear a couple of speakers that have implemented distance planning solutions from our healthcare region, from our Nordic region. At the next webinar on the 18th of, what date was
18th of November. Tune in on the 18th of November, same time as today at 1 o'clock CT. Yeah, and then we have the last one. It's about wearables and response service. We have done a mapping of what kind of wearables that could be a part of the future in healthcare and care, and also looking into how we handle the data. And you see the little bit complicated picture here of what we were looking at, the response service platform. And we'll get into deeper to this on the 14th of December when we have our fourth and final webinar. Yeah, I think that was our last slide, Niklas. I'll stop sharing here. Yeah, it's soon 2:30.
Very close to 2:30.
Yeah.
I think that this type of webinar is something that you are welcome to share with the stakeholders in your home countries and home regions that you think could be of value for them. You know now that we have this guide translated into English and into all Nordic countries soon, country languages soon.
Yeah.
And Kristin and Katarzyna has given practical examples from the use of that one. And as you have heard us saying again and again, that we don't see that much use of developing a new strategy of this kind, since this is a well-functioning one. And we know the success that they've had in Norway by implementing distance spending solutions for local authorities. So me and Bengt are saying thank you to you. And if you wish to get in contact with us, you can log in to our website, www.healthcareatdistance.com. And we will try to accommodate any questions that you have as soon as possible.
And hope to see you again on the 18th of November when we have our next webinar.
Thank you very much.
Okay, bye.
Bye-bye.